Everyone talks about IVF, but nobody actually explains exactly what's happening to your body at each phase. And that unknown makes women anxious. So here's the 6-step walkthrough that your clinic should be giving you. Step 1 is called ovarian stimulation. It's also called superovulation. But with IVF, the goal is to get multiple eggs to increase your chances. You'll be put on medication to stimulate this process, and your team will monitor your ovaries with ultrasound to make sure that your follicles are growing. Follicles are the fluid-filled sacs that your eggs grow in. Once your team is happy with how big your follicles have grown, you will get what's called a trigger shot. This is an injection that is timed for a 4-hour window, 34 to 38 hours before your egg retrieval. Step 2 is egg collection. Now this is a lot less scary than it sounds. You may be awake fully or under slight sedation, and you'll be given some pain medication before the procedure. A thin needle is used together with ultrasound to kind of see where it's going. The needle will then go through the wall of the vagina into your ovaries to collect your eggs. Step 3 is fertilization. There are 2 ways in which this can be done, either conventional IVF or through something called ICSI. In conventional IVF, eggs and sperm are placed together in the same dish and the sperm fertilize the egg naturally. With ICSI, sperm are directly injected into the egg using a microscopic needle. ICSI is usually used for male factor infertility, so if the sperm count is low or if the sperm are not swimming properly. Step 4 is known as embryo culture. Fertilized embryos are placed in the ideal environment for growth. Step 5 is embryo transfer. The best quality embryo is placed in a thin, soft catheter. The catheter is then inserted through the vagina and into the uterus. And then, using an ultrasound on your belly, you can literally watch this on the screen. The embryo is then placed in the uterus next to the lining. Step 6 is also known as the 2-week wait. This is the period of time that has to pass before you do a pregnancy test to confirm whether you're pregnant. It's during this phase where you will often be supported with progesterone supplementation. Stimulating the ovaries disrupts progesterone balance, and so you may be prescribed progesterone supplementation either through vaginal suppositories or injections to help to support the lining of the uterus to increase your chances of implantation, where the embryo attaches to the lining. The 2-week wait is often described as the hardest part of the IVF process. It's usually the time where you're going to need a little bit extra emotional support because anxiety levels tend to go through the roof. All the steps that have been done before are leading up to this moment, and in 2 weeks' time you're about to do a pregnancy test to determine whether the cycle was successful or not. IVF is a journey, and now you're more prepared than most people walking into their first consultation. So save this if you need to come back to it, and send it to somebody who may be going through IVF who may need this information. And all the best on your IVF journey.